This is a kid. Let's call her Amy. Now, Amy isn't alone. She's shaped by her environment and the people around her. She has a mom, a dad, a brother, friends, a violin teacher, extended family, and a whole social and support network that can impact her both positively and negatively. Yet for a long time in medicine, we have in many ways just treated Amy as if she was alone. Addressing her only as an individual, we have neglected to intervene in her world. And this approach, it hasn't worked that well. And it matters, because a lot of kids are suffering. In the United States, 4 million children have a serious mental illness, and 21%, more than 1 in 5 kids, have a diagnosable mental illness that impairs them in some way. Half of all lifetime mental illness begins before age 14, and 50% of teens with mental illness, they drop out of high school. Saddest of all, suicide is the third leading cause of death in youth.
The way that we approach treatment is to assess and treat the entire family with the assumption that the family system, as we can make it healthier, will move the kid forward.
We know from behavioral research in general that if you notice and encourage the positive in any situation, you're likely to see more of it.
There is relatively good evidence at this point that exercise and diet will actually change the brain. There's good evidence now that music changes the brain, music training, voice lessons. As you're looking at that and you're seeing that the changes in the brain function are in the areas involved with behavior, you go, well, wait a minute. That means that we've got changes in behavior from these things, we've got changes in the brain. It's basically all working on the same system.
The family-based approach developed from research. Each of the components have been studied in many research trials, and what the family-based approach does is combine all of those things together in one package.
And it's with all this in mind that we have created the Vermont family-based approach. Of course we engage kids, but we also focus strongly on engaging their parents in health promotion. We work with parents directly to address their strengths and difficulties so they can raise healthy kids. And we go beyond the clinic to help parents and their children pursue their interests in arts, music, and sports. We help establish their strengths and foster new ones. We partner with schools to engage kids in learning and develop their academic strengths. Of course, it all rests on a continually evolving set of research efforts with the ultimate goal of improving what we do. So what exactly is the Vermont family-based approach? It is the belief that emotional behavioral health is the foundation of all health. It means careful screening for all families with tailored promotion, prevention, and intervention. Specifically, we believe all families, those that are doing well, those at risk, and those already affected by emotional behavioral problems, they should have access to a family wellness coach to increase exercise, improve nutrition, and engage kids in health-promoting activity. At-risk and affected families should also have access to a focused family coach who will provide psychotherapy from a family-based perspective. And finally, affected families will work with a family-based psychiatrist who will provide expert assessment and health promotion while working with the entire team. Because we don't look at kids as isolated beings. Their mental health is a complex interplay between genetics and environment. They are dynamic human beings. We believe this must be the way forward for child mental health public policy, research, and clinical practice. And we call it the Vermont family-based approach.